You know that peptic ulcer is a common disease, the incidence between 10 to 12% and even more than that, and the pathogenesis of the ulcer is an imbalance between the aggressive factor that causing the ulcer and between the defense mechanism. The aggressive factors including the secretion of acid, pepsin, drugs that like the non-steroidal anti-inflammatory agents like aspirin, indomethacin, morphine, diclofenac sodium, and other, and also the presence of H. pylori. Also, many habits like smoking, alcoholism can affect the acid production and can cause erosion and ulceration. The defense mechanism include the secretion of mucus, the bicarbonate, the prostaglandins, the presence of prostaglandins that help in the formation and secretion of mucus and bicarbonate, the good blood flow, the cell regeneration, presence of phospholipid and free radical scavengers. The aim of treatment include the enhancing of host defense mechanism or eliminating and treating the presence of aggressive factors like treatment of H. pylori or increased acid by different drugs. So, in peptic ulcer, we have a damage in the mucosa of the upper GI tract. Could be in the stomach, in the duodenum, due to the increase in the gastric acid, in pepsin, in bile. قلنا هاي اللي سميناها ال causing factor or the damaging factor. And قلنا الامbalance between these damaging factor and the defense mechanism. الديفنس ميكانيزم عرفناها and depend on the presence of prostaglandins. ليش؟ ايش حتسوي البروستاجلاندينز؟ عندها في certain cytoprotective effect. How increase the mucus and bicarbonate secretion, improve the blood flow to the area, and also cause cell regeneration. فمن اللي حيزيد الميوكس؟ يزيد البايكربونات. ايش رح يمنع؟ هاي تسوي لنا فد layer prevent the back diffusion of acid that causing damage of the cell. We have certain effect احنا رح نسميها الacid peptic disease due to the presence of damaging factors. واحدة منهم هي البeptic ulcer. Could be gastric ulcer or duodenal ulcer. عندنا gastroesophageal reflux وعندنا pathological condition which is called Zollinger-Ellison syndrome. It's a tumor in the duodenum or in the pancreas causing increased secretion of gastrin which lead to increased secretion of acid. هنا حنرجع نلخص لكم ال causative factor of peptic ulcer. Increase in gastric acid, pepsin, in bile, decrease the defense mechanism, decrease the mucosal resistance, the role of H. pylori that lead to an increase in gastrin and HCl secretion, the use of non-steroidal anti-inflammatory agents and other drugs like steroid, smoking in certain habits like smoking, alcohol. Sometimes we have stress ulcer due to burn, to head injury and other debilitative disease. So the aim of treatment احنا ايش عندنا؟ احنا قلنا عندنا high acid. إذن acid when موجود in the lumen of the stomach. So may we give drugs that neutralize the acid. هالدراجز دائما احنا يمكن سامعين بيها نستخدمها اللي هي الانتي acid. So we have a chemical interaction at the lumen of the stomach between the HCl and the anti-acid. ولذلك راح يصير neutralization of the acid. أو عندنا drug that reduce the acid secretion like what? The H2 receptor antagonist and the proton pump inhibitors وهسه نجي على البقية. Or drugs that enhance the mucosal defense mechanism. Antacids are weak bases, so can neutralize the acid that are present in the lumen of the stomach. Pepsin is inactive at higher pH, so in the presence of antacid, pepsin is inactive. Also, colonization of H. pylori will be reduced or inhibited. Also, it can stimulate the synthesis of prostaglandin, which is important for the defense mechanism. We have different type of antacid vary in the chemical composition, in the neutralizing capacity, in the onset, in the duration of action, in the test, price, side effect. We can use it 1 hour after meal and also after 3 hour. يعني إذا واحد دا يتغدى الساعة 12 ياخذ الانتي أسيد ساعة 1 وساعة 3. Any drug that increase in the gastric emptying حيسوي لنا rapid gastric emptying، أو إذا patient عنده diarrhea إذا الإفكت of antacid will be reduced. ليش؟ أنا أريدها تشتغل وين؟ locally in the lumen، إذا ما أريدها تطلع من المعدة على السريع. So any drug or diarrhea can reduce the efficacy of the drug. But if we have food in the stomach or any drug مثلا anticholinergic drug، إيش وقت أنطيها؟ قبل لو بعد الانتي أسيد؟ لا، أنطيها قبلها. ليش؟ لأن هي تسوي delay in the emptying of the stomach، إذا اللي حتخلي لي الانتي أسيد يشتغل فترة أطول ويسوي لي neutralization of the acid. What are the therapeutic uses in all types of acid peptic disease? To reduce the pain, to promote the healing in the esophageal reflux. ليش؟ لأن هي حتعادل الأسيد وحتقلل البين والبيرنينج سensation وحتقلل الإيروجين اللي حيصير. بالإضافة إلى هذا نقدر نستخدمها كسورس of calcium when we use calcium carbonate as anti-acid، وإذا وين نحتاجه؟ in the treatment of osteoporosis. هسه نجي على individual anti-acid. احنا قلنا الانتي acid varies in the onset of action, duration of action, in the ingredients اللي موجودة بيها، بالنسبة للتست، للبرايس، وكذلك بالنسبة للادفيرس effects. نجي على أول واحد المغنيسيوم أوكسايد أو مغنيسيوم هيدروكسايد. كلها هي neutralize the acid, reduce the pain, reduce the burning sensation. لكن الادفيرس افكت ايش راح يكون بالنسبه للمغنيسيوم اوكسايد او هيدروكسايد؟ راح يكون دياريا. اذا البيشنت اللي ياخذ هيك نوع انتي اسيد يصير عنده دياريا. البيشنت اللي ياخذ الومنيوم هيدروكسايد حيصير عنده constipation، ولذلك شافوا انه اذا يستخدمون combination of magnesium hydroxide and aluminum hydroxide like the Malox can normalize the bowel function، ولذلك جمعوهم مستحضر جديد اللي هو المالوكس حتى ينظمون الباول فانكشن. شافوا انه الالومنيوم هيدروكسيد can bind to phosphate as chelating agent، ولذلك يمنع absorption of phosphate، راح يسوي لنا hypophosphatemia، ولذلك احنا لازم نشيك الفوسفات بين فترة وفترة. Sufficient aluminum absorption can take place in patient with renal failure. ليش؟ لأنه aluminum can be excreted by the kidney. Therefore, in renal disease, reduce the excretion of such aluminum hydroxide, so increase its concentration in the blood, reabsorbed and cause encephalopathy. For the calcium carbonate ممكن يسوي لنا milk alkali syndrome، لكن مش وقت إذا البيشنت يستخدمه chronically لفترة طويلة وياخذ وياه calcium supplement or dairy food containing calcium. ايش راح يصير عندهم؟ hypercalcemia, يصير renal insufficiency and metabolic alkalosis. Sodium bicarbonate can be absorbed, so contraindicated in certain disease, like in patient with hypertension, in cardiac disease, in renal disease. حيزيد لي الصوديوم لود. ممكن يسوي metabolic alkalosis. ممكن يسوي belching and flatulence due to liberation of CO2. ولذلك ينطون وياه دايميتيكون اللي هو reduce flatulence. ممكن يضيفون الجينيك أسيد للأنتي أسيد، مثلا الجافسكون هو تركيبة بها الجينيك أسيد وهي الأنتي أسيد to reduce the reflux of HCl، ولذلك ينطو بالرeflux esophagitis. In patient with renal failure, we cannot give aluminum or magnesium containing antiacid because their excretion will be affected since they are excreted by the kidney. Also, some drugs can be affected, يعني their bioavailability will be affected if they are given together with antacid. Either the antacid act as chelating agent, so reduce the absorption of such drugs, or affect the transit time، مثلا تسوي diarrhea, so also affect the absorption, and also may increase the intragastric pH، بينما احنا قسم من الادراك تحتاج acidic pH for the absorption. Therefore we can give the antacid, then after 2 hours we give the other drug. Some of the drugs that affected by antacid, like the tetracycline, fluoroquinolones, non-steroidal, and other. The action or the duration of action of antacid ايش راح تكون؟ حتكون short، ولذلك احنا لازم ننطي other drug for the treatment of peptic ulcer. So we can use different drugs that affect the secretion of HCl. HCl secretion is under the control of histamine. First of all, histamine. So we can give H2 receptor antagonist to reduce HCl secretion. Also under control of ACH. So we can give anticholinergic agent, gastrin. Also we can inhibit the action or reduce the action of gastrin. And the final pathway is the proton pump اللي هو hydrogen potassium ATPase system. Also we can use the proton pump inhibitors. For the H2 receptor antagonist, they can block the acid secretion first by prevent the binding of histamine to the H2 receptors on the parietal cell. Number 2, by inhibit the acetylcholine and gastrin action on parietal cell. Therefore, the acid secretion will be reduced by reducing the cyclic AMP as a second messenger. It is effective in treatment of Zollinger-Ellison syndrome. Why? Because it inhibits the action of gastrin. We have different members of this group. We have the cimetidine, the ranitidine, famotidine, and nizatidine. Cimetidine, ranitidine, and famotidine, they have bioavailability about 50% because they are subjected to first pass metabolism. لكن عندنا النيزاتيدين عندها البايو availability أكثر من البقية لأنه little subjected to first pass metabolism. Acid will be secreted according to stimulation by food or nocturnal secretion or basal secretion. So H2 antagonist will inhibit this acid secretion by about 70%. احنا قلنا عندنا nocturnal acid secretion. ولذلك إذا البيبتيك ألسر والبين عند البيشنت ده يكون ليلي، إذا we can suppress the acid secretion by the use of H2 antagonist effectively and cause ulcer healing by more than 90%. ليش؟ لأن النكتورنال acid secretion ده يعتمد على action of histamine. إذا إيش ننطي للبيشنت؟ ننطي single dose of the drug at bedtime at the evening for about 8 weeks. حباية واحدة قبل النوم لمدة شهرين. will cause ulcer healing by about 90%. هاي إيش وقت إذا احتاجينا to suppress the nocturnal acid secretion. زين، عندنا moderate action of such drugs if we have higher secretion of the acid according to stimulation by food, because in this condition the acid secretion under the control of gastrin and acetylcholine. الاسيد سكريشن انهبيشن ايش قد له حيكون يطول الفترة اللي يطول بها هالانهبيشن؟ تقريبا 10 hours. اذا احتاج انطي للدراجز twice daily بهالحالة. لكن شافوا انه ال H2 antagonist عندها higher adverse effect and drug interaction. اذا استعاضوا عنها بالبروتون بامب inhibitors. عندنا البروتوتايب of H2 antagonist هو السايمتيدين the first drug, and the prototype عندها half life about 2 hours. مثل ما قلنا نستخدمه شلون 400 ملغ tablet twice daily or 800 mg at the bedtime to suppress the nocturnal acid secretion. We said we give the drug for about 8 weeks. هذا الكورس مال التريتمنت ننطيه 8 أسابيع. هل شورت كورس رح يعطينا few adverse effect، لكن إذا نستخدمه chronically رح نشوف الادفيرس افكت اللي ممكن تصير شنو. أول شيء إحنا اللي عندنا headache, dizziness, abnormal bowel motion, could be constipation or diarrhea, muscular pain. هذه مقدور عليها. If we give the drug by rapid intravenous infusion, it will block the H2 receptors in the heart, so can cause bradycardia and hypotension. So we advise to give the drug by slow intravenous infusion, usually over 30 minutes. Also, cimetidine acts as non-steroidal anti-androgen. How? It will inhibit the binding of dihydrotestosterone to androgen receptors. At the same time, inhibits the metabolism of estradiol and increase serum prolactin level. So, in male, it will cause gynecomastia and impotence if the drug used for long time. And in the female, it will cause galactorrhea. CNS disturbances as confusion, hallucination can occur if we give the drug intravenously by large dose. Also, if we give the drug in elderly patient or in patient with renal or hepatic dysfunction. Cimetidine inhibits the liver enzyme, the cytochrome P450. So the metabolism of some drugs will be reduced, like the carbamazepine, the thiophyllene, lidocaine, and others. So increase the duration of action and the half-life of such drugs. Also, H2 antagonists will compete with creatinine and procainamide and other drugs for renal tubular secretion. So increase the level of such drugs and the creatinine in the blood. Nosocomial pneumonia can occur in patients using proton pump inhibitors or H2 antagonists. It should not be used in a pregnant woman or lactating woman unless it is necessary. since it cross the placenta and also secreted in breast milk. لكن studies ما كاملة إنه شو تسوي بالفيتس أو النيولي بورن بيبي، ما عندنا هالمعلومات، لكن ما دام يعبر البلاسنتا and secreted into the breast milk ما نستخدمه إلا للضرورة القصوى. What's about the pharmacokinetic? The drug can be given orally. Cimetidine, ranitidine, famotidine also present and available as intravenous formulation. Since they are metabolized in the liver and excreted by the kidney, so the half-life of this agent will be increased, and also the duration of action if we have liver or renal disease, and we need to adjust the dose. مثل ما قلنا widely distributed in body fluid, even in the milk and across the placenta, so avoided in pregnant and lactating women. It is metabolized by the liver and secreted by the kidney. How? Through the glomerular filtration and also by renal tubular secretion. For cimetidine, 30% slowly inactivated in the liver and 70% excreted by the. For ranitidine and famotidine, they have longer duration of action than cimetidine, also more potent, 5 to 10 folds for ranitidine, 20 to 50 folds for famotidine. Also, they have minimal adverse effect, mainly as anti-androgenic activity, less affecting the prolactin stimulating effect, no gynecomastia, not affect the cytochrome P450, so we have no drug-drug interaction. Partly metabolized in the liver and partly excreted and changed by the kidney. Nizatidine, the same potency and activity as ranitidine. 90% excreted and changed in urine, so in case of renal failure, avoid the use of nizatidine. Also, it has 100% bioavailability, since it is little subjected to first pass metabolism in the liver, but we have no intravenous preparation. H2 antagonists inhibit the gastric first pass metabolism of ethanol except famotidine، بس هو اللي ما يمنع الميتابوليزم of ethanol in the stomach. Other agent will increase the duration of action of ethanol. Some drugs need acidic media for their absorption. مثلا antifungal agent ketoconazole need acidic media. لكن شو يسوي لنا ال H2 antagonist reduce acid secretion, so we have high pH, so the absorption of ketoconazole will be reduced. زين، إذا ال H2 antagonist ده تقلل من ال HCl secretion يحتاج أنطي antacid to neutralize the acid يا acid، هو إحنا قللناه by the use of H2 antagonist. أقدر أنطي combination of H2 antagonist and proton pump inhibitor at the same time؟ لا، البروتون بامب inhibitor ياخذ وقت أطول حتى يروح يشتغل على البروتون بامب ويقلل من الأسيد سكريشن، بينما ال H2 antagonist هو رأسا بالبداية يشتغل على الريسبتر ال H2 receptors ويسوي لها بلوك ويقلل من الأسيد سكريشن. therapeutic uses وين نستعملها ال H2 antagonist بكل الأسيد peptic disease. treatment of peptic ulcer يصير recurrence، ممكن يصير in the presence of H. pylori, so we should give a treatment for the bacteria. in Zollinger-Ellison syndrome، ليش؟ لأنه هي رح تقلل مو بس الهستامين وال HCl، رح تقلل منه ال ACH action and the gastrin action on the parietal cell. زين، نستخدمها بالجرد gastroesophageal reflux، لكن هو يحتاج إلى فترة طويلة تقريبا 45 إلى 30 منت حتى يشتغل. استخدم الانتي اسيد ما يخالف بالجلد، لكن شنو هذه؟ تعطيني رابيد افكت لكن شورت، يروح بالعجل. اذا بهالحاله ممكن استخدم البروتون بامب انهبيترز mainly in the frequent and severe heartburn. acute stress ulcer، احنا نتوقع من debilitative patient، البيشنت اللي عنده head injury immobilized، اللي عنده burn، اللي هو بالانتنسيف كير يونت، يا اما عنده او نتوقع حيصير عنده ulcer، اذا ننطي for the treatment of the ulcer or prophylactic use of H2 antagonist or the proton pump inhibitor as intravenous infusion. قلنا prophylactically وإذا أكو ulcer treatment of the ulcer. tolerance ممكن يصير ويا ال H2 antagonist due to down regulation of the receptors. إذا بهالحالة رح نستعيض عنه بالبروتون pump inhibitors. We have another anti-secretory agents, a group of drugs that inhibit the secretion of acid. They are called the proton pump inhibitors or hydrogen potassium ATPase inhibitors. The prototype is omeprazole. Also we have lansoprazole, dexlansoprazole, the rabiprazole, pantoprazole, and esomeprazole. They are a prodrug، يعني بالحقيقة هم inactive. It will be activated inside the parietal cell. So they are a prodrug, a weak base. So its absorption is insufficient in the stomach. Therefore, and also they will be degraded by acid in the stomach. So they are covered by enteric coat. This coat will resist the effect of the acid and the drug will pass to the duodenum, where the coat is removed and the drug, we said it is a weak base, so it is lipid soluble, it will be absorbed again, then pass to the parietal cell where it will be converted into an active form. This active form of the drugs will bind covalently. Strong bonds will develop between the drug and the ATPase system. The enzyme will be inhibited for longer time, for about 18 hours, to be resynthesized again. So by a single dose of the drug, for example a 20 milligram omeprazole, we can inhibit the secretion of HCl for about 24 hours. Proton pump inhibitors are found to be superior to H2 antagonists regarding the reduction in acid secretion, the healing of peptic ulcer, and also in the treatment of erosive esophagitis. Also, they are found to be effective in preventing re-bleeding. مثلا احنا عندنا patient صار عنده bleeding from peptic ulcer وتعالج وتحسن، لكن مرة ثانية نخاف صارت عنده certain condition، احنا رح نتوقع يصير عنده bleeding again. مثلا صار عنده debilitative disease enter the intensive care unit، مثلا عنده burn، فرضا دا ياخذ non-steroidal anti-inflammatory agent تحتاجها، فنتوقع انه حيصير عنده bleeding. اذا ايش ننطي؟ رح ننطي proton pump inhibitors for 3 to 5 days فد كورس مكثف either orally with high dose. احنا قلنا السمولر دوز omeprazole هي 20 ملغ inhibits the acid secretion for about 24 hours. هنا ايش قد انطي؟ رح انطي 40 ملغ twice daily, or we give continuous intravenous infusion. هاي ايش قد نبقى ننطيها 3 to 5 days to prevent re-bleeding. ليش ننطي high dose؟ to get high pH in the stomach about 6. This will يعني هم شافوا بالدراسات انه هل pH of the stomach at 6 رح يصير عندنا enhanced coagulation and platelet aggregation. Also used in different type of acid peptic disease, Zollinger, the GERD, if we have ulcer due to the use of non-steroidal anti-inflammatory agent. Also we use the proton pumps inhibitors in the regime of H. pylori treatment. If the patient has gastrinoma or other hypersecretory condition, either resected by surgery, or if there is metastasis or unresectable gastrinomas, we can use the proton pump inhibitors. This group is very effective orally, so they are found in delayed release formulation. Also, some of them available in intravenous doses. The food will affect the absorption of these drugs, so the bioavailability will be reduced. Therefore, we advise the patient to take the drug 30 to 60 minutes before breakfast, except lansoprazole because it has a dual delayed release formulation. And also the plasma half-life is short، قد تقريبا few hours، لكن the duration of action is long. ليش؟ لأنه قلنا تسوي covalent bonds with the enzyme. The metabolites excreted in urine and feces. In general, these drugs are well tolerated with less adverse effect, but if they are used within the time of treatment, but if they are used for longer time, some of the adverse effects can occur, like omeprazole can inhibit the cytochrome P450 enzyme, so inhibit the metabolism of some drugs like warfarin, diazepam, phenytoin and others. إذا الميتابوليزم قلت معناها رح تشتغل for longer time، وخصوصا الورفرين ممكن يسوي bleeding tendency. إذا بهالحالة لازم شو نسوي dose adjustment. Omeprazole and esomeprazole decrease the effectiveness of clopidogrel. هو احنا قلنا بالبداية بالمحاضرات الأولى إنه clopidogrel is a prodrug needed to be converted by metabolism by cytochrome P2C19 to an active form حتى يشتغل ويمنع البليتلت aggregation. إذا بهالحالة إيش رح يصير؟ Omeprazole and esomeprazole inhibit this enzyme, so the conversion of the prodrug clopidogrel into active form also will be abolished. إذا بهالحالة رح يشتغل كأنتيبليتلت؟ لا. إذا the patient will be subjected to cardiovascular event, stroke, infarction من هالشغلات. Also can cause, proton pump inhibitors can cause renal lesions like acute interstitial nephritis or any other chronic kidney disease. ممكن البيشنت اللي ياخذ proton pump inhibitors for longer time, more than 1 year, subjected to fracture. Why? Because the calcium carbonate absorption will be reduced in high pH. بهالحالة رح نستعيض عن الكالسيوم كربونات، نستخدم calcium citrate as a source of calcium if the patient need calcium. Also, the absorption of vitamin B12 need acidic media. So when we have high pH, the absorption of vitamin B12 will be reduced. What's about the respiratory and enteric infection in patient using a proton pump inhibitor? Like with H2 antagonists, patient subjected to nosocomial pneumonia. Patient using H2 antagonist or proton pump inhibitor can be subjected to nosocomial pneumonia. Also, in patient using proton pump inhibitor, growth of Clostridium difficile can take place, and this will lead to diarrhea. So if the diarrhea is still for about 1 week, stop the treatment. gastric carcinoid tumor can take place، لكن الحد هسه شافوه بس بال research work، ماكو بالهيومن بينج، ما صاير الحمد لله. فشلون دا يصير؟ احنا عندنا الدراج بروتون بامب inhibitors، ايش راح تسوي؟ reduce the level of the acid. So this will stimulate the gastrin secretion. يجي جاسترين يصير بيه secretion in higher amount. ليش؟ حتى يزيد ويسوي لي stimulation للأسيد ريليز. بهالحالة أنا عندي الأسيد ريليز بلوكت باي بروتون بامب inhibitors، إذا الجاسترين دا ينفرز أكثر stimulate the growth of gastric epithelium، وهاي راح تتحول إلى ماس اللي هي carcinoid tumor. بنفس الوقت الريدكشن in HCl راح يزيد لي colonization of certain bacteria which convert the ingested nitrates into carcinogenic nitrosamine. هذه كلها العوامل اللي هي بالأساس ناتجة عن الريدكشن in HCl secretion اللي حتسوي لي الكارسينويد تيومر. You know that cholinergic activity will increase the motility of the GI tract and also increase the acid secretion. If we give the anticholinergic drug dicyclomine, this will reduce the acid secretion, so we can use it as adjunct therapy in the treatment of peptic ulcer and Zollinger-Ellison syndrome. Octreotide is a synthetic somatostatin analog which inhibits the release of different peptides hormone, gastric or pancreatic peptides. Since it inhibits the release of gastrin, so it is effective in the treatment of Zollinger-Ellison syndrome. Also lower the portal pressure, so it is effective in the treatment of portal hypertension and reduce the risk of variceal hemorrhage. Also we have a group of drugs which is called mucosal protective agent that enhance the mucosal protection and prevent mucosal injury, reduce the inflammatory reaction and the growth of H. pylori, and reduce the ulcer bleeding. Sucralfate is a complex or a mixture of aluminum hydroxide and sulfated sucrose. It binds to the positively charged protein in the ulcer, of the necrotic cells and also of the normal cells, forming a gel with the epithelium, forming a physical barrier over the lesion, over the ulcer. So prevent the acid and pepsin from reaching the area of injury and do more injury, and also allow healing. This is effective in duodenal ulcer and also in the treatment of stress ulcer. But due to multiple daily dosing, due to several drug-drug interaction, and also the presence of more effective agent, this is not so used. Its use is limited. It can cause constipation. ليش؟ لأن مثل ما قلنا بالسلايدات الأولى إنه يحتوي على ألمنيوم. Also it is contraindicated or need dose limitation in patient with renal insufficiency. It interferes with the absorption of many drugs because it acts as chelating agent، مثل ما يتحد ويا البروتين اللي بالسيلز ويسوي لنا فد بارير، هنا هماتين يتحد ويا الدراجز يسوي لنا دراج interaction and prevent its absorption. Also we have bismuth chelate or bismuth subsalicylate or colloidal bismuth. This is effective in healing peptic ulcer. خلينا نشوف الميكانيزم of action. Like the sucralfate, increase prostaglandin synthesis, increase mucus and bicarbonate secretion. Also, it can inhibit the pepsin release. The same as sucralfate can form a physical barrier along or over the injured mucosa. So protect the lesion from the back diffusion of acid and pepsin and promote healing. Also, it has an antimicrobial activity, so it is involved in the regime of H. pylori treatment. Effective in the treatment of traveler diarrhea. It is effective in reduce the frequency of stool and also the liquidity of the stool. So effective in treatment of traveler diarrhea. It binds to the enterotoxin. It can cause a black stool, so we can confuse from this side effect with melena. نتوقع إنه البيشنت عنده gastrointestinal bleeding that cause the melena، لكن بالواقع لما يجيك البيشنت وهو دا ياخذ بزمث سبساليسيليت ويقول لك عندي بلاكينج، أنت لازم أصلا بالأساس تقول له رح يتحول لون الستول إلى بلاك، فلا تخاف من عنده. إذا إحنا رح ننطي liquid formulation إيش رح يسوي؟ darkening of the tongue، بما أنه يحتوي على salicylate. إذا in large doses ممكن يصير عند البيشنت salicylate toxicity. Also we have the cytoprotective misoprostol. It is synthetic analog of prostaglandin E1 that inhibit the secretion of the acid and also stimulate the secretion of mucus and bicarbonate that protect the mucosa from back diffusion مثل ما قلنا of the acid and pepsin. ننطيه prophylactically in patient with non-steroidal anti-inflammatory agent induced ulcer. يعني البيشنت اللي هو elderly or with a previous ulcer ويحتاج non-steroidal anti-inflammatory agent ونخاف له يصير عنده، إذا elderly يصير عندهم ulcer، وإذا أبو الألسر احتمال يصير عنده recurrence ويصير عنده bleeding، فننطي prophylactically either misoprostol أو ننطي proton pump inhibitor. بما أنه الميزوبروستول less effective than the proton pump inhibitor and H2 antagonist, and in pregnancy can cause abortion due to increased uterine contraction وأدى adverse effect أنه ولو هي dose related لكن ممكن يسوي diarrhea and nausea, so we can use the proton pump inhibitors instead of it. Antimicrobial agents also needed in the treatment of peptic ulcer. First, to eradicate the H. pylori and to promote healing of the ulcer. We need endoscopic biopsy, serological test, and urea breath test to confirm the diagnosis إنه أكو عندنا H. pylori بالموضوع وإلا بنستخدم الانتيبيوتيك. Proton pumps inhibitors ليش نستخدمها؟ أول شيء هي عندها antimicrobial activity، ثاني شيء رح تقلل لنا الأسيد ريليز، إذا رح تزيد الانتراغاستريك pH. بهالحالة المينيمال concentration inhibitory concentration of the drug needed رح تقل عندي، ممكن ما أستخدم 50 ملغ of the drug، هنا 30 ملغ رح تسوي لي inhibition للgrowth of bacteria. We will get about 90% successful eradication of H. pylori within 2 weeks of treatment. عندنا 2 regime. الأول نستخدم 3 drugs called triple therapy. أول واحد proton pump inhibitors، فرضاً omeprazole twice daily 20 mg twice daily. Number 2 clarithromycin 500 mg twice daily. وياه نضيف either amoxil 1 gram twice daily or metronidazole 500 mg twice daily. لكن هنا عندنا failure rate due to the resistance to clarithromycin، إذا نستعيض أن بالquadruple الرباعي. The quadruple therapy include the proton pump inhibitors, for example omeprazole twice daily. وياهاش نستخدم 3 من أي واحد من الريجيمز اللي تجينا. Either we use bismuth, subsalicylate, metronidazole and tetracycline 4 times daily. إذا آخذ البروتون بامب انهبيتر twice daily, bismuth, metronidazole, and tetracycline 4 times daily. صار عندنا 4 drugs. نيجي على تايب بي أو ريجين بي اللي هي بروتون بامب انهبيتر twice daily, أموكسيل 1 جرام, كلاريثرومايسين and metronidazole. ذني الثلاثة الأخيرة given twice daily. ننطي أموكسيل, كلاريثرو, مترونيدازول twice daily. ورا ما نخلص الكورس قلنا for 2 weeks رح نستخدم البروتون pump inhibitors for up to 6 weeks to ensure complete healing of the ulcer.